The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
Breast cancer has come so far in the last 10, 20 years, and that news is devastating, but it is not a death sentence.
Coming up on today's show, a focus on breast cancer. We'll be talking with our experts about the latest in diagnosis and treatments. Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today is a very important show for women and the women in your life. We're talking about breast cancer. If you're watching us live now and you have questions concerning breast cancer, call us. Your questions may be answered here live on our program by our experts. The experts answering your questions are Dr. Rachel Goebel, a breast surgeon with Rex Surgical Specialists, and Dr. Joellen Specka, a medical oncologist with Rex Hematology and Oncology Associates. Both are part of the Rex Comprehensive Breast Care Program, a program designed to help patients navigate breast care from discovery to recovery. To call us here at Rex on Call, just dial that number on your screen in Wake County, 919-744-3876. Outside of Wake County, call us toll free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions directly to rexoncall@rexhealth.com. And you can even find us on Twitter. Send us a message at Rex Healthcare, #RexOnCall. 1 in 8 women will be diagnosed with breast cancer. 1 in 8 women. That means we didn't have to go far to find our first story. Kristen Johns, a nurse in the Clinical Informatics Division at Rex, finally took action on the reminder of from a coworker to get a mammogram. It saved her life. Now she's speaking out to help women in the same way.
Early detection is absolute key. It saved my life, and I really hope that it saves somebody else's life.
At just 37 years old with a 3- and 7-year-old, Kristen Johns had no signs or symptoms of breast cancer, but she did have a dream.
I had a dream from my aunt who had recently passed away telling me to go and have the mammogram.
At the same time, Rex employees received an email reminder encouraging them to get their screening mammograms. What was found changed her life. Johns had an aggressive type of breast cancer.
Breast cancer has come so far in the last 10, 20 years, and that news is devastating, but it is not a death sentence.
Kristen Knott, Johns' patient care navigator, helped her make sense of the diagnosis and treatment options. That's the unique role of the navigator.
The whole patient is so important, and we find that when we first meet these ladies, because the first thing that comes to their mind when they hear their diagnosis is, well, what am I going to do about my job? What am I going to do about my kids?
That total patient approach is part of Rex's comprehensive breast care program and includes the Breast Multidisciplinary Care Team. Here, patients are the focus of a conference that allows all of their physicians to discuss the best treatment options. Together, radiologists, pathologists, medical and radiation oncologists, even nutritionists are involved.
The patients then get the benefit of all these various specialists who come together and come up with a specific plan for their care, which is a lot different from meeting individual providers who may have different ideas about how to treat these conditions.
So many times there are issues that are going on with the patient that I, as a surgeon, might not know about. Social issues, financial issues, even nutrition issues. I mean, things that you just don't really think about as a surgeon necessarily that come out in this conference. Being aware of a variety of issues that are going alongside the primary treatment of the cancer really helps us treat the patient as a whole and their whole situation for the best outcome.
I felt like nothing was left untouched, that they were covering all aspects of my treatment, from my mental to my spiritual to my physical well-being.
And her patient care navigator, who's also part of the multidisciplinary team, was with her every step of the way.
She was the one that was there for me the minute that I woke up from the surgery. She was the first person to hold my hand. She was the first person to tell me that my lymph nodes were negative and I could relax at that particular point.
Joining us now are doctors Rachel Goebel and Joellen Specka. So in Kristen's case, in that piece we just saw, she's 38 years old and didn't have a strong family history, but got this reminder to get a mammogram. At what age should we be getting our first screening mammograms?
Well, for most women, we recommend getting a first screening mammogram at the age of 40. But if there's a family history of breast cancer, we recommend that you get your screening mammogram 10 years earlier than that person was diagnosed. So that's if you have a first-degree relative, a sister, a mother who had breast cancer, that you should get your mammogram 10 years earlier. So in that case, that would have fit.
Okay. And let's talk about this. It's the Angelina Jolie effect, I'm calling it. Because it appears there are more women seeking out that genetic testing and opting for double mastectomies. Talk to us about it.
So really, genetic testing, we think about women that present at age 50 or younger with a diagnosis of breast cancer, or if they have a very strong family history, again, the first-degree relative, or any ovarian cancers in the family.
Okay.
We want to think about genetic testing. And at that time, it's a blood test or just a spit test that we can do in the office. And that takes about 2 to 4 weeks to get back. A little bit longer now since the Angelina Jolie issue, so we have more volume of patients requesting it. So it takes a little longer now, actually.
But it's great that they're requesting it, but it's not a cheap test if it's not covered by insurance.
Correct. It's about $4,000. So that's why we like those criteria of younger than 50, first-degree relative. You have to meet those criteria for us to send the test off.
Yeah, but if you meet those criteria, insurance will step in.
Cover it.
Gotcha.
Absolutely.
Okay, and there are more women choosing to go for the double mastectomy as opposed to a lumpectomy. Do you think it's the Angelina Jolie effect? What do you attribute to that?
That really, as far as Angelina Jolie goes, if you have the gene or the BRCA gene, then the recommendation is bilateral mastectomy because you're an 80% chance of getting breast cancer.
Okay.
But what I think we need to remember is that this is a small proportion of the overall population.
Right.
For patients who have a breast cancer that's diagnosed and could be treated with a lumpectomy, I think that the risk is being overestimated in patients. The risk that another cancer will show up or that the lumpectomy isn't enough. And so it's important for patients to have that discussion with their doctor about whether they can safely have a lumpectomy to avoid such a major surgery.
Because it has been proven, right, that a lumpectomy with other treatments is as effective?
Absolutely. There's no survival advantage to going and having a bilateral mastectomy if you have a breast tumor that can be removed with a lumpectomy and radiation.
Okay, and radiation. Talk to us about what are some of the other treatments?
So if you have a lumpectomy, the follow-up treatment to that is radiation. And so the two of those treatments go together, and that treatment compared to a mastectomy is equivalent in terms of survival.
Okay. Talk to us about mammograms. Are they the best way to really diagnose still?
So mammograms definitely are still our best screening tool, and again, 40 is the age that we recommend. There's a new mammogram out that's called a 3D mammogram. This takes more pictures of the breast. It's in the same way they do them now, but just takes more pictures, and it makes a 3D image of the breast. Okay. Now that's still investigational, and it's not covered by insurance yet, so we're not using it as a screening tool yet.
Okay, but diagnostic, you would use that if there was an issue?
Still, you just would use a diagnostic mammogram. Wouldn't use the 3D mammogram.
Oh,
right.
Okay.
But I do think that is most definitely on the horizon, and I completely agree that it's a new tool to allow the radiologist to have a much better view of the breast, particularly for women with dense breasts, where the standard mammogram just doesn't give the best view.
Okay.
This allows the radiologist to see additional images of the breast, so that something that may have looked atypical with the 3D view, they can know better whether they need to call a patient back in for additional images or whether they can comfortably say that that was just an abnormality seen on the film but not in reality.
Okay. Now, we are back after the break to answer your questions. The phones have been busy, so give us a call, send us an email. We'll be right back. Welcome back to Rex on Call. We are taking your questions regarding breast cancer. Dial those numbers on your screen and give us a call. Here we go. This is from Barbara. She's 81 years old. She wants to know if she should continue with mammograms and for how long.
So that's a great question. I really personally recommend that if you can get to the place to have your mammograms or get to the center, then you should have them as long as you can.
Okay, there you go. This is from Anne. Does estrogen or estradiol cause cancer? She's on 2 milligrams daily.
You want to take it? You want to take it? So I really do not like, basically that's hormone replacement therapy. So you're adding hormones to your body, and I think that's really, if you can avoid that, that would be great. You know, quality of life is important as far as vaginal dryness, mood swings, hot flashes, and very important, but if you can minimize your hormone intake, I would.
Okay, I mean, that's a hot topic.
Yeah, absolutely. It is a hot topic. I would agree that minimizing the length of time that you're on hormone replacement and minimizing the dose as much as possible is advised, but to go about that plan with your doctor.
Okay, this question came from Hillsborough. Her daughter-in-law, she's 37 and she has breast cancer. Does the amount of estrogen in her birth control, would that affect her disease? Same thing?
Meaning she was diagnosed with a breast cancer while she was taking birth control.
Should she stop?
So yes, we would say to go ahead and to stop taking the birth control. Certainly her doctor will guide her through the recommendations regarding hormonal treatment, but most likely the hormonal treatment that she'll be on for her cancer will likely involve blocking hormones. So it would be doing the opposite of birth control.
Okay.
In terms of hormone replacement.
Okay, this question's from Durham. If breasts bleed, could that be cancer?
So I do see ladies present with bloody nipple discharge from the actual nipple. Now the most common cause of that is called a benign intraductal papilloma, which is not a cancer. So the most common cause is not a cancer, but cancer can cause bloody nipple discharge. So you need to go and see your doctor and be evaluated.
So what doctor should she see?
She should come see me.
Okay, just didn't know where we were sending her. There you go.
Surgeon. Yep.
Go see her. So this is Audrey. She's 56 years old. 3 of her sisters have breast cancer. What's the probability she will?
I'm curious if anyone in her family has been tested, if anyone related to her has had any of the testing that we were talking about for an inherited cancer. It would be best for someone who had the cancer in her family to go ahead and get the testing, because that would really help to guide whether she could get tested for it. But no question about it, she needs to have her annual mammograms done and not skip those, because just with that family history, you'd have to be pretty vigilant about doing your screening studies.
Okay, and this is from Debbie in Durham. She had chemo and radiation. Should she still, and this was 6 years ago, should she still be having these chronic problems of a frozen shoulder, maybe some shoulder pain, dry eyes, neuropathy? Those, I mean, should she still be having those symptoms after 6 years?
Well, the symptoms that you described of the dry eyes and some neuropathy, those can be some long-term side effects from chemotherapy, unfortunately. But in terms of the frozen shoulder, that sounds like that might be something from an injury or something from a poor healing process after a procedure.
Had lymph nodes dissected out on the side with the frozen shoulder. She can see physical therapy just to get her range of motion back.
Okay, so this question, she wants to know if there's any other test besides the $4,000 test, because online it appears that they're doing genetic testing online for $100. Cheek swab, does that give you the same results?
No. I would recommend staying away from anything other than what your doctor recommends.
Okay.
Nothing online testing.
Okay, and so how should men be doing their breast exams? And should they be doing them? And I just threw a pen at you. There you go.
Men should be, evaluating that. 1% of men of breast cancer is male breast cancer, and really it's just doing it the same way every time. And doing it in the shower when you're soapy is the best. Okay. So just to get your system down, whether you're going up and down, side to side, but do it the same way every time. You get to know your normal anatomy, and then you know when something's different.
Should they do this once a month?
Sure.
There you go. Okay,
The
coming
main
up.
thing would be if a man feels a lump, he should seek medical attention for that.
Absolutely. Okay, coming up next, we'll take you inside the new Rex Breast Care Center, and we'll answer more of your questions. Use one of those numbers on the bottom of your screen, or email us your questions at rexoncall@rexhealth.com. Stay with us. Welcome back to Rex on Call live here on WRAL. To reach us, call us at 919-744-3876 in Wake County. Outside of Wake County, call toll-free 877-277-6252. Email us at rexoncall@rexhealth.com. Now, when is a mammogram not a mammogram? When it's at the new Rex Breast Care Center. It's designed to feel more like a spa than a physician's office, and it just opened off the corner of Edwards Mill Road and Durley Road, and we got a tour. Take a look.
Hi, my name's Kelly Poe Jones, and I'm the manager of Rex Mammography Services. I want to welcome you to our brand new Rex Breast Care Center, and I want to give you a tour. Come with me.
This spa-like experience starts when your name is called.
We're entering our changing area. We wanted this area to be very peaceful and private. We have these nice robes that cover everybody up very nicely. They're warm, they're soft.
There's no TV in this patients-only room, just relaxing music and refreshments. Women undergo diagnostic and screening mammograms. For diagnostic studies, a radiologist studies the images right away. If necessary, abnormalities can be examined.
We have two different ways that we can biopsy breast abnormalities here at the new Rex Breast Care Center. One of them being stereotactic biopsy, and this is our breast biopsy suite. This is our ultrasound suite where we do ultrasound guided breast biopsies as well as regular breast scans.
As women, we all have to be screened, and the new Rex Breast Care Center is making sure it's a convenient, relaxing experience.
Thanks for coming to see us today here at the Rex Breast Care Center. Ladies, don't forget, make your appointment for your annual screening mammograms. Come see us and we'll take excellent care of you.
Okay, now on to some questions. This is from Marjorie. She's 83. She has a pacemaker. Is a mammogram still recommended?
Yes. Yeah, she can still get her mammograms without any trouble.
Okay, Cassandra, should a woman be concerned about having dense breast tissue, and how do you know if you have dense breast tissue? Good question.
Well, dense breast tissue has really been a topic lately because we're learning that with dense breasts, the mammogram isn't as good because the radiologist doesn't get as good of a view of the breast because it's so dense. So a woman would know she had dense breasts based on her mammogram, and many of the reports now will tell a woman if she has dense breast. And really the new wave will be the 3D mammogram that we were talking about, which really helps to go around that problem and get a much better view of the breast in spite of dense breasts.
So you only can really know if you have dense tissue if you get the mammogram. Okay.
It's typically associated with younger breasts, and as you age, the fatty tissue tends to replace it, and then the mammogram is a bit easier to read and not quite as dense.
Okay.
You also get an MRI as an option as well.
Okay, and that would be recommended by a doctor. Okay, Maria from Raleigh, right breast has pain every now and then. What could that be?
So pain really can be related to a lot of things that are not cancer. Usually don't associate cancer with pain, however, not 100% of the time. So pain can be from caffeine intake, tea, coffee, chocolate, lots of those that could cause breast pain. You need a good support bra, that has a lot to do with it. Vitamin E and over-the-counter primrose oil can help with those, with breast pain.
Okay, those are all good topics. Okay, coming up, we'll have a final round of your questions after the break. This is Rex on Call. Welcome back to the show. This is Rex on Call, and we're taking a final round of your questions right now. Let's get right to it. This question's from Goldsboro, North Carolina. How do you determine the symptoms of breast cancer? What are they?
That's a great question, because I think it helps us to remember that most women don't have symptoms when they have a diagnosis of breast cancer, and so you really have to do your mammogram. But one symptom certainly would be if you felt a mass, any kind of lump, a rash of the breast should also be evaluated.
Okay, speaking of rash, this question just came in. At the top of the breast, she has a rash that leaves a scar. Is that a sign of breast cancer?
So not typically, but she should definitely be evaluated and have a good physical exam by her physician.
Okay, and how many years, or what is the time range? This patient had breast cancer and a double mastectomy in 2004. What is the time range in which she can call herself clear?
Oh, that's a great question.
Yeah, that's a great question. She still needs to get followed and do her routine health care follow-ups and evaluations. But we say that we know that at 5 years the risk of a breast cancer recurrence really do drop significantly. So, and she definitely has earned the right to call herself a survivor.
Yes.
But she always needs to stay up with her screening studies. She should go for your colonoscopy, go for your annual physical exam with your primary care doctor.
Okay. Rosemary from Hope Hills, if your mouth tastes really metallic after your first chemo treatment, is there anything she can do to combat it?
That's a really common symptom. Basically, going with bland foods, avoiding extreme temperatures can help with that.
Okay, good luck, Rosemary. Okay, and this is from Jackie. If you're having a lumpectomy, but the cancer has moved to the lymph nodes, would treatment require chemo and radiation, or just radiation? Or is that a hard question to answer?
Well, it's a hard question to answer. She definitely will be getting evaluated for chemotherapy and or radiation. You said she's having a lumpectomy?
She's having a lumpectomy.
So we know with the lumpectomy she'll have to get radiation. Whether she'll have to have radiation to her lymph node area will really depend on whether the lymph nodes are involved, how many, how large they were. And the chemotherapy decision also will be based on the size of the tumor, if the lymph nodes were involved, and the subtype of the tumor.
Okay. This is Tammy from Dunn. Her paternal grandmother had breast cancer. Her maternal grandmother had ovarian cancer. She wants to know if she's technically higher risk, and so would insurance pay for that genetic testing?
With that family history of ovarian cancer, especially, and added on top with the breast cancer, most definitely I would recommend that she go ahead and seek testing.
Okay. Margaret from Fayetteville, she had breast cancer in which she found a lump, but it didn't even show up on the mammogram. Is that common?
We do see that, and that's why we do recommend an ultrasound also when they have a mammogram and they can feel a lump. So she would have an ultrasound as well, but sometimes mammogram can't see everything. So, yes.
That is right. Okay. And again, we're getting a lot more questions on dense breasts, so I feel like we need another explainer. This is not something that you're going to be able to feel yourself.
No.
Has to be a mammogram.
Right.
Correct. So again, it's hormone related a lot of the times. So younger ladies, 40s, 50s even, are going to have denser breasts than our 80-year-old ladies. If the 70 or 80-year-old ladies are taking hormone replacement therapy, Prempro, Premarin, they're going to have denser breasts as well. So a lot of it's hormone related too.
Okay, and what about fibrocystic diseases?
A lot of fibrocystic breast disease is associated with dense breast tissue, so they can go hand in hand. Neither of these are really well established as risk factors for breast cancer. It's most likely that those findings make it a little bit more difficult to see a cancer, but as we move forward in the field, the 3D mammograms are really going to help that a lot.
Okay, and all the more reason to get screened on a regular basis.
Absolutely.
Okay, now it's time to head over to the Rex Connects blog at rexhealthblog.com, where you can see entries from the famous Hope the Cow. Yes, Hope the Cow has started blogging. She's part of the international public art exhibit called Cow Parade. This month she's giving us some insight into the new Rex Breast Care Center. And it's time to think pink. Rex Healthcare is sponsoring a list of events to bring awareness to breast cancer and prevention efforts. Check out the Carolina Hurricanes #RexSave promotion this month during the home and away games. Listen for the announcement and tweet RexSaves, #RexSaves, for a chance to win an autographed hockey stick. And October 22nd, it's Ladies' Night Out in Clayton Radiology Oncology. It's a joint partnership between Johnston Health and Rex UNC Healthcare. It's free. There's makeover and massages. I'm there. And to find out more, rexhealth.com/pink-October. As always, consult with your physician about any health concerns. And if you're looking for a doctor or need a direct referral, you can always call Rex HealthNet, Rex's free telephone information service. It's 919-784-4490. Thanks so much, ladies, for coming out to join us. And thanks to the phone bank. I know you guys were pretty busy today. And join us for our next Rex on Call. And we're talking about vein health. So send us your questions. It's on November 18th. Send us your questions at rexoncall@rexhealth.com.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.